If you're a senior trying to lower blood pressure with turmeric, you might be wasting it completely. Most people take it in a way that delivers almost zero benefit, even though the research clearly shows it works. The difference is not turmeric itself. It is how you take it, what you combine it with, and when you take it. By the end of this video, you will know the exact method that actually lowers blood pressure, including one simple combination most people completely miss. Here's the problem. Let us get straight to it. Most seniors who take turmeric for blood pressure are either adding a pinch of turmeric powder to their food or taking a basic turmeric capsule from a grocery store shelf. Both of those approaches deliver a dose of curcumin, the active compound, that is so poorly absorbed by the body that the cardiovascular effect is minimal at best. This is not a theory. It is one of the most consistently documented challenges in turmeric research, and it is the reason so many people try turmeric for weeks and feel nothing. Here is what is actually happening inside your body when you swallow turmeric powder or a standard capsule. Curcumin, the compound responsible for turmeric effects on blood pressure, vascular function, and inflammation, is hydrophobic, meaning it repels water. Your gut is a watery environment. When curcumin reaches the intestines in its standard form, it does not dissolve efficiently, so most of it passes through and exits the body without being absorbed. Studies have consistently measured the oral bioavailability of standard curcumin at less than 1% in human subjects. That means if you take a teaspoon of turmeric powder containing roughly 30 to 50 milligrams of curcumin, your bloodstream may receive less than half a milligram of active compound. That is simply not enough to move blood pressure, improve vascular function, or produce any of the cardiovascular outcomes the research documents. Here's the pain point that makes this genuinely frustrating for seniors specifically. The research showing turmeric reduces blood pressure, improves arterial flexibility, and lowers systemic inflammation consistently uses curcumin doses of 500 to 1,500 milligrams of highly bioavailable curcumin daily. Not milligrams of turmeric powder. Milligrams of actually absorbed curcumin reaching systemic circulation. Standard turmeric powder and basic capsules simply cannot deliver that dose regardless of how much you consume, because the problem is not how much you take in. The problem is how little of it your body can use. The good news is that there are 3 specific modifications to the way you take turmeric that change the absorption picture dramatically and completely, and every one of them is practical, affordable, and supported by clinical research in senior populations specifically. Before we get into exactly what those 3 modifications are, tell me in the comments where you are watching from and how long you have been managing high blood pressure. If this is already making sense of why turmeric has not been working for you, subscribe to Cardivive and hit the notification bell so you never miss a video. If this is helping you, type great in the comments, or improve if it is not. I want to keep improving for you. The first modification is switching from turmeric powder to a standardized curcumin extract, and this single change makes more difference than anything else in this video. Standardized curcumin extract means the product label specifies the percentage of curcuminoids, the active compounds, typically expressed as 95% curcuminoids. This is the form used in virtually every clinical trial showing blood pressure benefits from turmeric. When you see a product that just says turmeric root powder and does not specify curcuminoid content, it is almost certainly a low bioavailability product. Beyond the extract standardization, the form of the curcumin matters enormously. Researchers have developed several enhanced delivery systems that dramatically improve how much curcumin actually reaches your bloodstream. The 3 most researched are curcumin with piperine, which is the active compound in black pepper, phytosome curcumin, which binds curcumin to phospholipids for better membrane absorption, and nanocurcumin formulations that reduce particle size to improve solubility. Of these, curcumin with piperine is the most widely available, the most studied specifically for blood pressure outcomes, and the most accessible in terms of cost. For seniors specifically, piperine-enhanced curcumin is the recommended starting point because the research base for blood pressure reduction is the most mature and the formulations are the most widely available. The dose that clinical trials consistently use for blood pressure outcomes is 500 to 1,000 milligrams of curcuminoids daily in a bioavailable form. With a standardized piperine-enhanced extract, 500 milligrams per day is achievable in 1 or 2 capsules and produces the absorption levels the research uses. For seniors with established hypertension, some trials have used 1,000 milligrams split into 2 doses, morning and evening, and this approach consistently produced stronger blood pressure results than a single daily dose in the same total amount. Starting at 500 milligrams and assessing your response over 4 to 6 weeks before increasing is the most prudent and well-supported approach. Here is something worth knowing before we continue. The way you take turmeric is only part of the picture. The foods you eat every single day are either compounding the cardiovascular benefit of turmeric or quietly working against it. That is why I put together a complete heart health nutrition guide in my Etsy shop covering the specific foods shown to lower blood pressure, the dietary patterns that support vascular health, and the foods most seniors think are heart healthy, but the research says otherwise. The link is in the description. Here is the modification that most turmeric content never properly explains, and it is the one that produces the single biggest jump in curcumin effectiveness for blood pressure. Piperine, the compound that makes black pepper spicy, is a natural bioavailability enhancer. When it is present alongside curcumin in the digestive tract, it inhibits the enzyme systems that would otherwise rapidly metabolize curcumin before it reaches systemic circulation. The result is that curcumin survives long enough to be absorbed at dramatically higher levels than it ever reaches without this combination. A study published in Planta Medica found that combining curcumin with just 20 milligrams of piperine increased curcumin bioavailability by 2,000% in human subjects. 2,000%. The mechanism is piperine inhibiting glucuronidation, the liver process that rapidly tags curcumin for excretion before it can reach the tissues where it produces its cardiovascular effects. Without piperine, the liver processes most absorbed curcumin out of the bloodstream within an hour of absorption. With piperine, curcumin remains in circulation significantly longer, giving it the time it needs to reach arterial walls, vascular endothelial cells, and the systemic circulation where blood pressure regulation actually occurs. For seniors taking turmeric for blood pressure, piperine is not optional. It is the difference between a supplement that works and one that simply does not. The practical approach is simple. If you are taking curcumin in supplement form, look for a product that already contains piperine, often listed as bioperine on the label. Most quality curcumin supplements include this. If you are adding turmeric to food or drinks, add a generous pinch of freshly ground black pepper every single time. 1/4 teaspoon of black pepper alongside your turmeric delivers more than enough piperine to produce the bioavailability enhancement. Here is the problem, and let us get straight to it. The combination reflects thousands of years of observation that piperine and curcumin work better together. Most seniors take their supplements first thing in the morning because it is easy to remember alongside other medications. For turmeric specifically, morning is actually one of the better timing windows, but only if it is taken correctly with food and fat. Here is what most people never realize about the connection between the time of day you take turmeric and how much blood pressure benefit you actually get from it, and the research on this is genuinely specific and worth knowing. Blood pressure follows a circadian rhythm, rising sharply in the morning hours from roughly 6 to 10 in the morning, and then gradually declining through the afternoon. This morning surge is the highest risk window for cardiovascular events in seniors, and it is also the window when anti-inflammatory and vascular protective compounds are most needed in the body. A study in the Journal of Hypertension found that curcumin taken in the morning consistently produced greater reductions in morning systolic blood pressure compared to evening dosing at the same dose. The mechanism is that curcumin inhibits the inflammatory signals that amplify the morning surge, and these effects are most therapeutically relevant when the compound is present during the surge itself. For seniors splitting their dose between morning and evening, the morning dose should always be the larger of the two. Curcumin is fat-soluble, meaning it requires dietary fat to be absorbed through the intestinal lining. Taking turmeric on an empty stomach or with a fat-free meal dramatically reduces absorption regardless of whether piperine is present. 1 tablespoon of olive oil, a small handful of nuts, half an avocado, or the fat naturally present in a meal with eggs or fatty fish is sufficient. For seniors who prefer a morning turmeric drink rather than a capsule, adding a teaspoon of coconut oil or a splash of full-fat milk to the preparation provides the fat carrier that makes absorption possible. This is the section most turmeric guides skip entirely, and it is where seniors can make one of the biggest practical differences to how much cardiovascular benefit they actually receive from a consistent daily protocol. Most people focus entirely on which turmeric product to buy and how many milligrams to take, and then they pair it with the wrong foods and cancel much of the benefit before it even begins. The foods you pair turmeric with on a daily basis determine whether curcumin reaches your arterial walls at therapeutic concentrations or passes through your digestive system without producing meaningful cardiovascular effects. The most powerful food pairing is turmeric with black pepper and a healthy fat, all in the same preparation. A traditional golden milk made with warm plant-based milk, 1 teaspoon of turmeric powder or half a teaspoon of standardized curcumin extract, 1/4 teaspoon of black pepper, and 1 teaspoon of coconut oil or ghee delivers all 3 absorption requirements simultaneously and conveniently. Olive oil is equally effective as the fat carrier and has its own blood pressure-lowering properties through its anti-inflammatory compounds. Avocado is an excellent fat carrier that also provides potassium, one of the most important minerals for blood pressure regulation in seniors. Fatty fish like salmon complement the anti-inflammatory mechanism of curcumin with omega-3 fatty acids. Eating turmeric with any of these foods consistently produces the compounding vascular benefit the research documents. A practical daily routine for seniors is a morning golden milk with turmeric, black pepper, and a fat carrier, or a curcumin capsule with piperine taken with a meal that contains healthy fat. The evening dose, for those splitting it, pairs well with dinner that includes olive oil, fatty fish, nuts, or avocado. The key is daily consistency without gaps. A study in the American Journal of Cardiology found that curcumin benefits on endothelial function were only sustained in participants who maintained daily supplementation throughout the full trial period. Those who missed doses regularly showed significantly blunted outcomes at the 8-week mark compared to those who were fully consistent. If you are finding this helpful and learning things about turmeric that nobody has properly explained to you before, please hit that thumbs up button right now. It helps this video reach another senior managing blood pressure who needs this information. It takes 1 second and genuinely makes a difference. Let us talk about what you can actually expect from turmeric when it is taken correctly, because the research is specific and the evidence is worth knowing clearly before you invest weeks of daily effort into a protocol. Most supplement marketing for turmeric makes claims that are either exaggerated or stripped of the critical context about dosing, form, and duration that determines whether those outcomes are achievable. Here is what the clinical literature actually shows for seniors taking bioavailable curcumin consistently, and it is genuinely encouraging when the numbers are put in their proper cardiovascular context. A meta-analysis published in the journal Nutrition found that curcumin supplementation produced a statistically significant reduction in both systolic and diastolic blood pressure across 11 randomized controlled trials. The average systolic reduction was 3.03 millimeters of mercury, and the average diastolic reduction was 2.81 millimeters. These reductions are clinically meaningful. Research from the Framingham Heart Study consistently shows that even a 2 mm sustained reduction in systolic blood pressure is associated with a 10% reduction in stroke risk and a 7% reduction in coronary heart disease risk. These reductions compound with other interventions including dietary changes and appropriate medications. The studies showing the strongest blood pressure reductions used bioavailable curcumin at 1,000 milligrams per day for 8 weeks or longer. Curcumin lowers blood pressure naturally through several converging mechanisms that work simultaneously rather than through a single pathway. It increases nitric oxide production in vascular endothelial cells, signaling arterial smooth muscle to relax and directly reducing vascular resistance. It also inhibits the ACE enzyme through a different molecular pathway than ACE inhibitor medications. And it reduces the chronic inflammatory signaling that progressively stiffens arterial walls over time, which is the primary driver of the age-related rise in systolic blood pressure that affects the majority of seniors. A study in nutrition research found that curcumin supplementation significantly improved flow-mediated dilation, a direct measure of vascular flexibility. In postmenopausal women with endothelial function characteristics similar to many seniors with elevated blood pressure. Here is the part of this video that most people need most and hear least, and if you have been taking turmeric for weeks without any noticeable change in your blood pressure readings, the answer is almost certainly somewhere in this list. The mistakes that cancel turmeric benefits for seniors are not obvious. They are not dramatic failures like forgetting to take it entirely. They are quiet, consistent habits that look completely reasonable on the surface, but silently eliminate the majority of the cardiovascular benefit that the research shows is possible. Most people making these mistakes have no idea they are doing it. The first mistake is taking standard turmeric powder and expecting clinical results, a mistake that accounts for the majority of people who conclude turmeric does not work for blood pressure. The second mistake is taking it without fat or piperine. Even high-quality standardized extracts have significantly reduced effectiveness without these two cofactors. The third mistake is taking it irregularly. Curcumin requires consistent daily presence to produce its cumulative vascular effects. The fourth mistake is expecting it to compensate for a diet high in processed foods, refined sugar, and sodium. Curcumin is a powerful addition to a heart-healthy foundation, not a substitute for one. The fifth mistake is expecting results in 1 to 2 weeks. Clinical trials showing meaningful blood pressure reductions consistently run for 8 to 12 weeks of daily use. The interaction issue is one that seniors must take seriously. Curcumin can amplify the effects of blood-thinning medications including warfarin and aspirin, potentially increasing bleeding risk. It can also enhance the effects of anti-hypertensive medications, which can cause blood pressure to drop lower than intended. Anyone taking medications for blood pressure, blood clotting, or blood sugar should consult their doctor before adding a high-dose bioavailable curcumin supplement. This is a reason to have an informed conversation with your healthcare provider so the combination can be monitored and medication doses adjusted if needed. Before we wrap up, I want to come back to the Heart Health Nutrition Guide in my Etsy shop because the turmeric protocol we have covered today works best when it sits inside a broader dietary pattern that actively supports vascular health. The guide covers the specific food combinations that amplify the blood pressure benefits of curcumin, the heart-healthy eating patterns with the strongest research behind them for seniors, and the foods most commonly eaten by people with high blood pressure that are quietly making things worse. If you want a complete nutritional framework to pair with what you learned today, the link is in the description. Setting realistic expectations is genuinely important here, and not just because it helps you avoid frustration. It matters because the timeline of turmeric benefits for blood pressure does not match what most people expect when they first start. And that mismatch between expectation and biological reality is the single most common reason seniors give up before the protocol has had the time it needs to work. Understanding the week-by-week progression of how curcumin works on blood pressure means you know exactly what you are looking for and when, rather than searching for dramatic changes in the first 2 weeks and concluding that nothing is happening. In weeks 1 and 2, most people do not notice dramatic changes in blood pressure readings. What you may notice is improved digestive comfort, reduced bloating, and in some cases, better sleep quality. Do not interpret the absence of immediate blood pressure changes as evidence that it is not working. Week 3 and week 4 are when many seniors begin to notice that morning blood pressure readings are slightly more consistent and slightly lower. By week 6, the research shows endothelial function markers are measurably improving. By week 8 to 12, the full blood pressure effect is typically visible in regular home monitoring. Track your readings daily so you have data rather than impressions. Here is what I want you to take away. The evidence for turmeric and blood pressure reduction in seniors is specific, reproducible, and clinically meaningful. But taking it correctly matters enormously. Standardized curcumin extract with piperine, taken with fat and food, at the right dose, consistently every day, for at least 8 weeks, is what the research actually studied. If you have been taking turmeric powder with water and wondering why nothing has changed, now you know exactly why and exactly what to do differently. If this video gave you a clearer picture of how seniors should take turmeric daily to lower blood pressure, Please share it with someone you know who is managing high blood pressure. So many seniors are taking turmeric the wrong way and concluding it does not work, and they deserve to know there is a specific evidence-based protocol that does. Subscribe to Cardivive and hit the notification bell so you never miss a video. Thanks for trusting me with your precious time and your heart health. I will see you in the next video.